Dear Mr. Chairman, thank you very much for the kind introduction. I think my enemy in this presentation is time, and I like very much to respect the time, so maybe I will fly through some of the slides, if you can bear with me. I'm going to speak about overview about closure devices, and these are the topics I'm going to touch quite rapidly. Vascular closure devices are going to be increased over the next few years because of a lot of procedure like EVAR and TEVAR and PEVAR, and we always like our patient to get up and about quite quickly. That is why if you follow the market of endovascular, they don't increase in the last 10 years exactly the same. Some devices are getting more, some are getting less over the next year. So you can see this is the closure devices, and it is rapidly growing market. This is very nice slide to mention. So definitely vascular closure devices are here to stay, and we should always train to use them and select what to use. The first question, are they better than our golden standard, manual compression? This is extremely important, and we must rely on evidence-based medicine. For that, I will refer to two pivotal trials, which is ISAR-closure trial and the PEVAR trial, because beyond any doubt, they mentioned the non-inferiority of vascular closure devices over the golden standard. So ISAR-closure device is one of the trials that is ended in November 2014, and they were comparing, it was made in Germany, they were comparing two devices compared to the golden standard of manual compression. And this is the study flow. They are about 4,500 patients. You can see about 1,500 use Femoseal, Axoseal, and the manual compression. The result in nutshell was the complication if you're using vascular closure device is 6.9%, while the complication if you're using manual compression device was 7.9%. So you can see you are safer if you are using closure device. And this is a big number, and this is a statistically significant. If you look at the complication, although the complications are much higher in the manual compression group, you can see this is the amount of hematoma. You get more hematoma with manual compression rather than vascular closure, but you get more pseudoaneurysm in vascular closure devices. And that is why learning curve is very important in these devices. This is the primary and secondary endpoint of the study, but the conclusion was very clear that vascular closure devices are non-inferior to manual compression. So this is very important before we continue about discussing these closure devices. Now the second trial is the PEVAR trial, which is multi-center between United States and Europe, and they took the standard surgical exposure to common femoral artery to percutaneous closure. And for that study, they have used two devices, which is the devices that were used was the closure devices, ProGlide and ProStar, in equal number 50 and 51, and compared to the surgical standards. This is again quite a big number, 151. It took 4 years to finish, and they again confirmed the safety and the efficacy and non-inferiority of these devices. This is a comparison, and you can see you are as good with a closure device as you are with surgical exposure. So I'm a vascular surgeon, and maybe intervention wouldn't need us to do venous or arterial cut down anymore. Maybe this is a history. So they concluded again that the result of the study was striking, that you get a shorter procedure time and shorter hemostasis, patient go home quickly, and you have less complications. So actually you are better off doing it endovascular rather than getting your colleague vascular surgeon to do it. So beyond any doubt, vascular closure devices are non-inferior, if not better than open femoral exposure. So this is the first 5 minutes of my talk. Now the second one, I'm going to classify them. And this classification, you can divide them into 3 groups. Either active approximator, you approximate it like a surgeon with either suture or clips. And for suture, you have a ProGlide and ProStar, and for clips, you have ISAR-closure. And there is a passive approximator group. You can use plug, like the Angioseal, or you can use VASCADE, or you can use gel sealing. For that, you have 4 devices: Mynex Ace, Mynex Grip, Exoseal, and Fish. And the last group is external hemostatic device. And for this, you have Cartiva, Cartilist, 2 and 3, and Axera. Every bit of these devices have intelligent idea by the one who developed it. I will just have a glimpse of the idea. It could never impossible to pass across through what has happened. So these are the active approximator, and they depend about intelligent idea that you get the ProGlide, 2 wings inside the artery with a suture, and 2 needles hit it. It's exactly like the surgeon doing it by surgery. So you can see the technique, it's a beauty. You get an exact needle, and this cover between 5 French to 21 French. But obviously, anything above 16 French, you need to do 2 ProGlide, 1 at 10 o'clock and 1 at 2 o'clock. So this is a ProGlide idea, which is a great idea. And this is the idea of a clip, which exactly as it mentioned, it's a clip. And you can see you get a guide wire into the lumen, the device will go in, will have this kind of tilt into the vessel wall, and then you got a clip. And this clip will just punch the occluder. But this, you have a maximum of 8 French. You can't use a clip other than 8 French. So this is the idea behind the clip. Now the passive approximator depend about Angioseal, and you can see the Angioseal technique, which again is a guide wire, and you select where it is, and you put a plug, a PGA plug, and this can go up to maximum 7 French. It wouldn't go up to 8 French, because of the plug technology. So this is a plug. The VASCADE, again, is another clever idea, which you go inside the artery, and after you go inside the artery, you get the hemostatic plug after having this disc from inside. This is the only disc which stay inside the vessel, and then you get a plug which is being injected into the wall. So I got 3 minutes left. This is the FDA-approved gel-based closure devices, Mynex Ace, Grip, and Exoseal. I got the 2 videos simultaneously, one for the Mynex Ace and the other one for Mynex Grip. They are 2 different ideas. You get an occluding balloon from inside the vessel that goes up, and then it occluded, and then you put a gel, and you trigger intrinsic, extrinsic way of cascade of clotting. The Mynex Grip have protamine sulfate, while Ace doesn't, but both of them are equally effective, and this is the idea behind them. Now, this is the idea about Exoseal. Again, very clever idea from being intraluminal, make sure the blood is in, and then you put the plug when the 2 marker becomes black. And this Exoseal done by Cordis, and it is even better than exposure, than manual compression. Now the fish devices are 2 devices, which again, the same idea about the passive approximation. Now this is the FDA-approved vascular compression assist, which is another tool of closure devices, which is Cartiva 2 and 3 and Axera. And these are the Cartiva 2 and 3. I tried to put the video to run simultaneously. You can see this is again another clever idea. You go inside and you make a disc inside the vessel, and then you go up with the disc to occlude it from intraluminal, and you must have a little bit of tension. Notice that each of these closure devices have a learning curve, and you must at least attend one of the training courses and try to assist at least 10 before you start doing a closure device. And carefully select what closure device you're going to use. This is the last one, is Axera, which is totally different technique. You have the puncture, and you put the guide wire, and from this puncture, you put another axis with another angled needle that goes inside the vessel, and then you push what is called the closure device that you actually close the hole. Totally different idea from someone who has invented the idea to do closure. And this is the Axera access device, which goes up to 8 French. So this is a lesson that I have got learned over the last 45 minutes, 45 seconds of my presentation, that VSD are here to stay. We must all get trained about using them. And there is a steep learning curve. Never to use vascular closure device without a previous training. Every minute detail, and you get a huge amount of tips and tricks with each one of these devices, and you must have your own experience, and there are multiple tips and tricks with each one. So with 10 seconds left, I think I've beat my enemy, and thank you very much.